we have public comment from Bonnie O'Leary. So Bonnie, the floor is yours.
Thank you. This is very, very brief, but every 2 years, the Northern Virginia Resource Center for Deaf and Hard of Hearing Persons applies for a regional grant for people with disabilities, which we've had for well over 20 years. And so we're preparing that now. And I just wanted to say thank you on behalf of all of us at NBRC for the lovely letter that William wrote on behalf of the Commission on Aging to support our grant application. So thank you from all of us.
Thank you, Bonnie, for your hard work. Really appreciate it.
Thank you.
Rachel, any other public comments?
No, that was the only public comment that we received.
Okay, thank you both. All right, Tanae, I see you are ready to roll. So thank you so much. And we look forward to your presentation on the Aging and Disability Resource Center trends and highlights. Please take it away.
Good morning, everyone. One moment, I'll be sharing my screen.
Settings, privacy camera.
Okay, is everyone able to see that?
Yes.
Yes.
Yeah, great. So good morning. Again, I'm Tanae Young. I'm the program manager for the Aging and Disability Resource Center, and I'm just here to provide some updates about the ADRC and the Benefits Enrollment Center. One moment, my computer is not cooperating. Okay. So staffing. So the ADRC is made up of 8 staff, the supervisor being myself, along with our ADRC coordinator, which serves as our lead clinician. A few months ago, roughly 6, we brought in our human services clinician 2. We also have 2 overstrength specialists, one serving as the homelessness prevention specialist. We also currently have 1 vacant position. We have 2 contractors as well who support our program that are grant funded just because of the sheer volume that we've been seeing. So the timeframe covered is going to be between July of 24 and June of 2025. And during that time, we served over 8,000 clients, and this number is duplicated. So most of our client contacts are by phone calls with a few in-person visits, as you can see. Other means usually covers things such as mailing, email, any sort of team meetings that we may have on clients' behalf. We also started collecting race data on one of the areas where we document, and the majority of the clients that are served are either Black or African American or white or Caucasian American. Okay. We do see some smaller numbers of Alaskan and Natives and Hawaiian and Pacific Islanders. Those numbers are still very small, but we do have some representation there as well. And feel free to ask me any questions as I go along. I can't see you, so someone please just let me know. Now, as far as needs, so the needs requests have been pretty consistent. We've had over 4,600 needs requested, the majority being food. So food would include things such as AFAC renewals or initial applications, Meals on Wheels referrals, or even assisting with SNAP, so referring clients for food stamps. We also have a lot of financial assistance requests. So those requests tend to be around housing, so usually rental assistance or utilities. And as you can see from our financial requests during that time frame, we had over $700,000 in requests. Now, we were not able to actually help clients in that amount. We probably help with about 20% of our requests that come through for various reasons. But, you know, financial requests is one of our biggest requests, followed by food. In-home care has also increased significantly recently for us. So this would include referrals either to our community living program, the Medicaid waiver program, or sometimes private care options that are available. Housing is another increasing trend that we've seen. So we've had a lot of clients who are looking for housing options that are affordable or needing to be rehomed. So we provide those services and supports to clients as well. There is always an uptick in our shelter referrals as well for older adults. As you can see, it says 197. However, 197 individuals were not placed into shelter. These are referrals, discussions that we've had with clients in reference to shelter. So this may include individuals who are not Arlington residents that we were able to connect to shelters in other jurisdictions, or clients who were initially referred to shelters and were able to be rehomed prior to going into shelter. Now, one point I wanted to point out on our graph is our homelessness prevention. We do have a homelessness prevention specialist whose goal is to focus on deferment from shelter, rehoming, and providing those supports. And even our numbers there have gone up since we've had this position. I think initially when we first brought in a homelessness prevention specialist, we were seeing around maybe 30 cases, and it has increased to 57 in that time period. And this person is providing extensive case management and supports to clients. So this could be home visits or providing support in court as well. So the Benefits Enrollment Center, we received a grant in January of 2024 from the National Council on Aging, making us one of 3 benefits enrollment centers in Virginia. So as a benefits enrollment center, we're able to support older adults and individuals with disabilities. And the focus is getting them connected to 5 core benefits, which include SNAP, LIHEAP, which is energy assistance, Medicaid, Medicare, and Medicare Extra Help. Now, to do that, there is a screening tool that is used through the National Council on Aging's website. Actually, anyone around the country can use it. You're simply putting in a zip code, putting in some demographic information, and then from there, a report will be created for services and benefits that clients are eligible for. So these services are not limited to the 5 core benefits. I mean, we refer clients and assist with applications for transit benefits, discounted phones and internet, SSI, SSDI, veteran supports, unemployment. So there are a variety of services that we can support clients with through the Benefits Enrollment Center. Now, so far through the BEC, we have served over 600 clients and completed over 700 applications. As a part of our grant, we collect a lot of demographic information. And as you can see, the breakdown looks a little different for the BEC compared to the ADRC. So again, the majority race that we're serving are Black and African American clients, but this time, Hispanic, Latino, Spanish origin clients are second in line, and then white clients compared to the demographics, we see in the ADRC. We also track things such as age range. So as you can see, we are definitely supporting older adults, the majority being 65 and older. Services. So the majority of the applications that we are completing for the BEC is related to food. And again, this is mainly SNAP and AFAC from what we've seen. The other categories, as you can see, are fairly small, but our biggest requests for applications has been around food. We are also seeing that many of our clients are single individuals, so that's information that is tracked as well. And our goal is always to serve those who are most vulnerable. So as you can see, the majority of our clients receive under $15,000 annually in income. Another important area that the BEC focuses on is outreach. So from our outreach events, we have been able to serve over 600 clients. Currently, we are at AFAC monthly. We've also participated in events at Culpeper Gardens, Path Forward, Hunters Park, the Community Engagement Forum, and recently in May, we had our inaugural Older Adult and Caregivers Community Benefits Fair, which was a huge success. Now, through our benefits fair, we were able to serve over 200 attendees. We had great vendors from many of our community partners. We were able to do health screenings on site. We had raffles and giveaways. Capital Caring has a robotic pet program, and we were able to raffle off 6 robotic pets along with other prizes to our attendees. So it was a really great event where we were really able to connect with our clients. I mean, we have a lot of clients who registered. We had some who just kind of heard there was an event happening and walked in. And really, we got a really great feedback from this event, and we're looking forward to making this an annual event. So again, what we're seeing is that a lot of our older adults are presenting with a lot more complex needs. You know, in our ADRC, we see walk-ins Monday through Thursdays between 9 a.m. and 3 p.m. with a 1-hour break from noon until 1. In the past, a lot of our meeting times were anywhere from 20 to 30 minutes, on a very critical case, maybe 40 minutes. Now we're meeting with clients anywhere from 40 minutes to 90 minutes just because of the nature of the support that's needed for the clients that we are seeing. We have a lot of clients who come in for different reasons, for shelter, for financial assistance. And during those meetings, we're determining that there are other supports and services that they would benefit from. So we're working to connect them to those services in support of what the original need is. We're also seeing with our homeless population that they're coming in with a lot more complex needs. We've had clients who've simply been dropped off in a hospital gown and not able to really tell us, where they're from, give us information about family. So we work with many of our other programs, such as APS or adult services, to connect those clients to services and get them stable. We are also looking for support and advocacy around staff. We are a very small team. Our numbers are constantly increasing, and we've had to make an adjustment to our walk-in schedule because of that. In the past, we would see clients from Monday through Fridays, but we had to leave time for our staff to really be able to manage the cases, to complete their documentation. And without the right support, there could be either a drop in the level of service or the documentation. We really do not want that to happen. We want to be able to continue to provide great service to our clients, to work their cases from start to finish, to make sure that they are accurately getting connected to the services that they need. And to do this, we definitely need more staff. We also have some volunteer opportunities that are available. So if anyone would like to use their skills to support the Benefits Enrollment Center or participate in our outreach events, feel free to scan the QR code. We are always looking for volunteers who can serve in different capacities. We're also looking for outreach opportunities. So if there are any events coming up where you would like us to have a table, or if there's a group or residents you would like us to visit and talk about our services, you can reach out to me and we'll be glad to set that up and have our team to go out and connect about the services we have available here in Arlington. We are also actively looking for interns. We don't currently have an intern. I believe we have one coming in August, but this is an opportunity for us to train the next generation of social workers and human services workers, but they also become a really integral part of our team and provide additional support that we need. And finally, grant opportunities. There's so much that we would like to do, but it takes funds to be able to do those things. So if you're aware of any grant opportunities, if there are opportunities that we can piggyback on, please let us know. And yeah, we really need the support and really being able to get more information out there. Since we've started to do outreach, we've had so many connections with clients that we would not have normally seen or who would not have called us or come into our office. So we're always looking for opportunities to grow the BEC. And that's all. So if there are any questions, I'll be glad to answer them.
Do we have any questions? Do we have any questions for today? Well, Tanae, thank you so much.
You're welcome.
Really appreciate your excellent presentation, and all of Arlington, especially those with the greatest and social and economic needs, really benefit from everything that you and your team do. So thank you so much. All right. I see next on our agenda is Marta, and Marta, really appreciate your joining us today and giving us the benefit of your experience and providing an update on Culpeper.
Thank you very much. I appreciate the opportunity. I'm sure you're all aware of the difficult decision that the board had to make on behalf of the financial sustainability of the future of Culpeper Garden. It wasn't done easy. It was over a prolonged period of time where we looked into every possible remedy, concept, notion, opportunity that we could to extend, which we had been doing for some time. An interesting thing, there's a letter from 2004 where the board chair at the time wrote a letter to Arlington County articulating the exact same issues that we're dealing with today. So this has been something that's been challenging for many, many years. Without the support of Arlington County, it would have been impossible. But we are now looking and facing a situation where we just have to do what we think the board feels is in the best interest as they have a fiduciary responsibility to the future of the organization. So based on that, we have been working tirelessly to help our residents find new options and places to live. We are getting them signed up for every possible AG grant if they qualify, open places where they can get on a wait list, all the kinds of things that we need time for. We have allocated a year, which in the business that we're in, other colleagues, usually when they've closed their assisted living, and many have done it in 6 months. Knowing this population and the challenges that we face with them, we have made it for a year. So we are working with staff and outside resources to give them every possible option. We've also hired a woman named Joanne McCarty, and she is, I'm going to tell you that she's a geriatric care RN who has a company called Independent U. She works here in Northern Virginia with her team, and we are setting them up with residents to talk them through an assessment of where their loved one is in terms of their care needs. There has been discussion, could some residents stay in their units? And we are exploring that now and working with HUD and DSS and all the various entities here in Virginia to make sure everything's in compliance. But we also want families to understand what won't be provided, what independent living is, and then backfill. So we are talking to various organizations that could be supportive in that and could, supply various care, and then what the families would have to consider themselves, laundry, all kinds of things. So we're just trying to do this in a gradual way and present the information when we have it locked down. So we don't want to speak out about things that we don't have secured. And I think that that's critical. As much as we want to make it all better, we have to do this in a measured way and a calculated way as we walk our way through this in the best way we know possible. So we are working tirelessly to support the residents, work with the county, make sure we understand what services are available, what is possible for the residents outside of the building, and then is it possible based on the organizations, the governing bodies that we work with, to remain in compliance, how we do that, how we support the residents in that way. And I don't have an answer for that today. Another reason we needed a year is to really make sure that we do things properly and give the right information at the right time.
Marta, thank you very much. Thank you for doing everything for your residents and for Arlingtonians, especially in this challenging environment. So really appreciate it. All right. I will move on to the next item on our agenda. That is the approval of the May 2025 meeting minutes. Does anyone have any questions or comments about the meeting minutes? All right, all in favor? All right. Any opposed? I don't hear any opposition or see it, so the meeting minutes are approved. All right, we will next go to the staff reports, starting with Rachel.
No, good afternoon or good morning, everyone, I guess. And I just wanted to comment that there was one correction on the minutes. Molly was present at the June meeting, so we'll make sure to make that correction and revision for Molly being present. I do want to thank Marta for being here and providing that update regarding Culpeper Garden assisted living. We know that this was a very tough decision, and we remain committed to working together to ensure that the residents, their caregivers feel supported during this transition. But it is affordable assisted living options are extremely limited. And for Arlington, that is pretty much Mary Marshall remains the only affordable assisted living option for Arlingtonians. But I do want to also provide an update, and Charlie, I see your hand, I'll give you a moment. But just share a few updates and first recognize Carlos. This is Carlos's final meeting after 6 years on the Commission on Aging. And we just want to thank you, Carlos. We have a certificate that we'll present virtually, but next time we see you, we'll present to you. Just want to thank you for all of your contributions, your energy, your creativity, your outreach, your passion for those underserved and underrepresented communities in particular. But you have made such an impact, and so we are extremely grateful to you and for you. So please give Carlos either a virtual or just a round of applause. So thank you so much, Carlos. We have been extremely busy. We've had vacancies in every department within our Community Supports and Coordination Bureau. The volume of work that today just presented is with the team being short-staffed for pretty much the entire year. But we have some vacancies and positions we're filling in the ADRC, in our adult services, adult protective services team, our adult day team. And then, of course, Helen's retirement, we have identified an absolutely stellar individual to step into the role, and that person will join us on July 28th. So 1 week from today, we are so excited to welcome that individual, and we'll look at having a meet and greet with them. But just really excited and so proud of the team who've been working so hard with staff shortages and vacancies. And so just really excited to welcome some new staff, new ideas, and just the opportunities that we'll have there. Just two updates on trends that we're seeing with the population that we're serving. Adult protective services, for the first time, financial exploitation cases have exceeded reports of self-neglect. So the work that Roland and the outreach team have been working on with Michelle Thomas and VICAP has been so critical and so important. So I think we're going to look more at addressing scams and how we address that to try and prevent financial exploitation. And then, as Tanae mentioned, homelessness among our older adults continues to grow. The complexities of these cases continue to take time to address. And as options for sort of long-term care maybe become a little more minimal, we are going to have to work really creatively to address some of those needs and gaps. And then the last thing I want to mention is the county fair. I included that in the read ahead that I sent, the email, but Michelle Thomas has created a sign up sheet, and we will be staffing a table at the county fair. We'll have some outreach materials. The commission, of course, is under recruitment, so we'll have some flyers there to try and recruit some new members at the fair. But if you're interested in volunteering at the fair, helping to staff a table, and then get your deep fried Twinkie, please reach out to Michelle Thomas to sign up. It really is a great time. And I think a lot of the individuals we end up talking to are caregivers who usually have not heard about our services before. And then again, just the last thing I want to mention, I know I said that before, but this week closes our public comment for the area plan. Our 30-day public comment is open through July 23rd. So there is still an opportunity to weigh in on our area plan. That is our contract with the state about how we're going to spend federal Older Americans Act money, state funding. As of Friday, we had about 12 comments, and the majority of individuals had not heard about the AAA prior to the public comment period and the area plan. So please take an opportunity to review the slides from the June meeting, visit the website. We'll put it again in the chat, but there is an opportunity to weigh in for the public comments. So really just want to encourage everyone to share your feedback. That will be incorporated in the plan. It's also sent to the state as well, but please do take a few moments to comment during the public comment period for the area plan. Charlie, I don't know if that's for me or maybe for Marta.
It's actually for Marta, but thank you for that report, Rachel. Marta, if I may ask, and I know this is a moot point at this time, but what would it have taken to financially sustain the assisted living wing for the long term?
We surmised it would be about $25 million in an endowment that we could skim the top of to underwrite care for the residents.
And that would produce an annual support of what, a couple million?
Enough for us to pay for it. It's extremely costly to run the program and continue with staffing. Our staffing costs doubled since COVID. So as the costs increase, other places, the Catholic Church, other religious places that may have subsidies, even they are facing closure because it's just hard to find. There is no sustainable model. There's no government money. And unless you have incredibly deep pockets, it's extremely difficult. So that we looked at that a couple of years ago, and that was really the number that we came up with.
I understand. Thank you.
Yeah.
Yes. Thank you, Marta. And thank you for everything you're doing in this very challenging environment, nationally, locally. It reminds me of the old saying, if you're not concerned, you're not paying attention. So a lot of things going on. Thank you so much. All right. Imuna, looking forward to your comments.
I'm on the phone.
Did somebody say something?
Yes. This is Claire. William, this is Claire Jacobson. I'm on the phone.
Okay.
May I ask a quick question of Martha and possibly Rachel?
Well, yes, go ahead and ask Marta, please.
I wanted to ask, I know Martha made a comment about assessing some of the residents with the view of possibly or potentially keeping them in the independent living option or program, in the IL program. I know that some of the IL residents get assistance from a company called Home Care Partners, better known as HCP. They are on contract to the county, to DHS, and also some medical assistance from another contractor called Medical Team, I believe, Rachel. Is there a possibility in order to possibly keep be able to keep some of the ALF residents into the independent living resident? Is there funding to increase staffing hours of the HCP caregivers and also additional staffing hours from the medical team? Is that an option? You may have already looked at it, so I apologize if I'm redundant.
We're looking at all options, and we do have to make sure that HUD and DSS are in agreement for this and make sure that everyone understands the needs and the shift. So there are some layers to this that we need to filter through, of course, but I think it's a reasonable question and something that I hope to speak to Rachel and Maimuna about at some point to see if they can help us work through some of this together. And so I think it's a process that we're going through, but I think it's smart, and we have a bit of time to work through this. The sooner I know from HUD, I'm sending them a letter today. We talked to DSS. They require a plan when you release people from assisted living. So we need to be accountable to DSS and that in Richmond. And so there are some boxes we need to tick, but I'm eager to explore that and eager to work through the possibilities and the options. Definitely eager. So those are good questions.
Yeah, and
Okay,
I
thank
can
you.
say, yeah, no, I can just share,
Go
you
ahead,
know, from
Rachel.
the county perspective. And Claire, thank you for raising the point. We do have for our community living program, that is a local program. Home Care Partners and the medical team are the two vendors that we refer to for that program. Those are primarily homemaker services, so a lot of support with instrumental activities of daily living. We also have staff that screen for the Medicaid waiver for individuals who qualify. That is a program that's operated through the state. An individual has to qualify for Medicaid as well as meet nursing home level of care, but that service can be provided in the home. And so I think, you know, these are going to be conversations that we have. The county has supported Culpeper Garden Assisted Living with financially for a care subsidy. So I think, you know, we will be looking at how do we repurpose some of those funds. But I think it's also, you know, just the reality of looking at the time we are in as well. With the passing of the recent legislation, there are going to be additional attacks and potentially reductions to Medicaid at a time when people really need these services. So, you know, I think, again, the opportunities for advocacy from this board, from this commission, this body, Northern Virginia Aging Network, and our other advocacy arms are going to be very critical to ensuring funding for the Older Americans Act and other programs that support older adults, especially at a time where many more individuals are going to need these services. We can't continue to sort of level set the funding. But I think these are just going to be additional conversations that we have as more information is shared. But thank you so much for the question, Claire.
Thank you, Rachel, and thank you, Martha. Thanks.
Great, thank you so much. All right, next is Maimuna's report. Maimuna, we look forward to your comments.
Good morning, Commission on Aging members and the public and colleagues. I have very brief announcements. As Rachel mentioned, these are different times. We are definitely monitoring Anita Friedman, Deborah Warren, the DHS leadership very closely on the impact that the legislation will have and the changes to Medicare, Medicaid, and SNAP programs. So it's too early to share any information, but as you all are aware, there is going to be impact. So we will provide those updates once we get the guidance. I do want to say on a bright note, and always a bright spot is your advocacy matters. I'll give you a brief example of how that advocacy played out recently. And I want to take a moment to just spotlight Erica Wood and Ann Herman. Recently, just a few months ago, or several months ago, we presented our RAFT program, which is a regional mental health mobile diversion program that you all probably are familiar with, and we can certainly have them present in the near future. But we presented through Jim's wonderful forecasting that he does that we were going to reach a very critical shortfall this fiscal year and beyond. RAFT funds have remained stagnant and pretty flat for over the course of a decade. And we are looking to place more individuals in assisted living and nursing home as a diversion to psychiatric institutionalization. And so, with the cost of assisted living today and rising, it leaves us very limited on our subsidizing our RAF clients. So, we presented this package. And Erica and Ann, in their championing and advocacy, fierce advocacy, were able to go to Delegate Hope. And thanks to Delegate Hope, we were able to get a one-time funding for RAFT for this start to the fiscal year to help us with expansion funds. And the advocacy continues, but that's just one example of a substantial increase that we received a one-time funding thanks to Erica and Ann and Delegate Hope. So we really appreciate that. And we know that this work can't be done in a vacuum in isolation. And we definitely rely on our powerful champions in the community. So that's an example. But outside of that, we are, as Rachel mentioned, we're fortunate to be able to recruit some dynamic talent for our vacant positions. And so we are seeing a trend of those that or have been laid off on the federal landscape. It's not unusual for us to get 100 to 200 applicants for our positions now in recruitment. So leadership team is very busy reviewing applications and quickly recruiting members, but that is also a bright spot is that we can recruit and we are filling the positions with talented individuals. Any questions for me in terms of the division or the programs? Well, thank you so much for all that you do.
Thank you, Maimuna, for everything that you do. It's always great to work with yourself, Rachel, and your colleagues at DHS. Next, I'm going to move to the chair's report and executive committee. I know Jim is here. Rachel, will Jim be providing any comments now, or am I jumping ahead here?
Oh, is this related to the STAR?
Right. Is that a different
okay.
time?
No, I guess, yeah, if you want to start off, yeah, Jim is going to provide some updates about the recent, there was
I
a
don't want to,
recent,
I don't want to take Jim out of turn if he's planning something else, but yeah. So
no,
if you
no,
want,
he's,
go ahead.
no, he knows. I was just going to set a little bit of a context is
Go
there was
ahead.
a recent article in our Now regarding an audit of the STAR program, which is one of our shared ride programs, primarily paratransit for individuals. And we will look in to have in the fall staff from the Department of Environmental Services join us. But Jim is very involved with the STAR program, the contract. So we wanted to address at least sort of the immediate concerns that were raised and provide some context and let you know that we do take those seriously, but Jim can give some updates as we look to invite staff from DES in the fall. So Jim?
Yeah, sure. No worries, William. Happy to jump in. I'm a nimble individual, as I like to say. So yeah, as many of you may be aware, there was an article in Arl Now about this the audit that the county auditor did conduct about the operations. One point I do want to make is that the audit covered the old contract, which was over 10 years old and was significantly in need of updates, both to the performance metrics, the operations, just the overall conduct of the interactions between the county and the vendor. So some of the findings that you will see in that audit report were already starting to be addressed in November and December when the new agreement was awarded. And they have been working on, the DES folks have been working on implementing those updates, specifically, the travel logs and the safety concerns that were pointed out. I know that they've been working with them, the vendor on that, and making sure that they're more clear and measurable performance metrics, because one of the key items that is included in this award is that there are credits back to the county when the vendor doesn't achieve those metrics, right? And so that was a key area that was added when this new award was made. So I'm confident that the folks in DES Transportation are going to be addressing these issues. The issues are not specific around like safety, like ridership safety. It's more about vendor relations. But as Rachel stated earlier, we're going to make sure in the fall that DES staff come and speak to the Commission on Aging to address some of the items that were pointed out in the audit, and then also some of the strategies that they're implementing to address them. So more to come. Appreciate your patience, as everything else, like it takes a little bit of time to get availability and such in order. And we'll certainly make sure that the DES transportation staff are here to address any of the concerns for the commission.
Great. Thank you, Jim. So does anyone have questions for Jim? Right, I'm not seeing anything, so we will move on. Thank you so much, Jim.
Of course.
Yeah, if people want to look at the article, they can certainly Google it. All right, thank you. Okay, so going to the chair's report and executive committee, we have a number of items listed, but I do want to say age friendly. I've chatted with committee chairs and asked them to talk to the committees and to identify 2 to 3 goals or sub goals that the committee is excited about accomplishing by the end of the year, and look forward to hearing about those things. And just to recap, this is a very challenging environment nationally and locally, and thanks to everyone at the county level, at the commission level, with the public for stepping up. You're doing a lot, and appreciate your stepping up to do more if you can. All right. And on that note, we've covered Culpeper, we've covered STAR. There was also a heat emergency last month, and if you go to look at your house address on Zillow or another real estate platform, you'll see that this area has high extreme heat danger, and So last month, the Park and Recreation Department canceled outdoor activities on June 23rd based on the heat index, which is a combination of the temperature as well as humidity. And as you all know, we have a lot of both of those factors. So it's especially dangerous for older adults. There are things that you can do to your house to keep it cooler. And what the county does is provide cooling shelters as well as spray parks. And so on, some of the videos went off, but I just want to make sure that people are aware of the cooling centers, because a lot of counties provide them, but people either don't know about them or can't.
I think some of that heat
Did
and
William-
humidity is affecting William's connectivity.
Oh, no. Oh, no, William.
I am. Okay, you're all coming back on. So it's probably on my side. Sorry about that. Electronic meeting policy.
Oh, no.
It looks like he's frozen in the seat. It's amazing.
I know. I can share a little bit about the electronic meeting policy, and hopefully William is able to come back with technology. But I shared a copy of the draft electronic meeting policy in the meeting read ahead. This is a requirement per the updated General Assembly and FOIA regulations that at least once a year, each commission and advisory board must present and adopt an updated electronic meeting policy. No commission or advisory board is permitted to have a virtual meeting like the one we're having without an updated electronic meeting policy. So as William would probably mention if he has some connection, we do, a copy was attached, so we do need a motion to adopt the, hopefully that does help Kathy, yes. And if he's not able to come back, would you mind chairing the meeting? But yes, is there a motion to formally adopt the 2025 electronic meeting policy for the Commission on Aging?
I move that we adopt the policy.
I'll second.
Okay. All right, Roland, thank you. Seconded by Michael. So it is before the commission. All in favor, please raise your hand or say aye.
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 All right, is anyone opposed? Please indicate by saying nay. All right, that looks like it unanimously passed. So thank you all for helping the commission remain in compliance. Kathy, are you comfortable to step in?
Yeah. Well, William, are you back? I see he's still frozen, but okay. Yeah, we can move on. It looks like the next item on the agenda is the legislative committee proposal that Rachel sent out with all the meeting materials. And this was a legislative, and I think we talked about it at our last meeting in June. William had invited Erica to present a recommendation regarding the current structure and function of the legislative committee for the Commission on Aging. And what was submitted was the proposal that I think we need to kind of review, answer any questions about, and take a vote on if we want to move forward with it as it stands. So hopefully you all had a chance to take a look at it. And okay. And I can go over maybe the key pieces of it, if that would be helpful, so that we're all clear on what this new proposal is stating for legislative activities of the commission. And as we heard from Maimuna, this is a really important part of what the commission does in terms of advocacy for legislative activities. So the functions of the coordinators And the commission chair would appoint 2 legislative coordinators who would work as a team on legislative activities. So the functions would be participating in NVAN, the Northern Virginia Advocacy Network, and bringing NVAN platform before the commission for approval. In collaboration with the executive committee, ensuring that the NVAN platform as adopted by the commission is communicated to the county for inclusion in the county's legislative package. Also in collaboration with the executive committee, ensuring the committee chairs have reviewed the platform and ways in which it might relate to their committee efforts, which I think is really important. That also kind of relates to kind of the goals and objectives of the age-friendly action plan as well in some cases. The coordinators would also track the progress of the NVN legislative issues and report back to the commission. And then also in collaboration with the executive committee, consider whether to convene a fall legislative forum and planning for such event. So that's, and I think that would be, maybe that hasn't happened in several years, but in the past it might have happened. I'm not sure. Maybe Erica can fill in on that. But Erica, anything else you want to add about this proposal?
Yes. Thank you, Kathy. So as you can see, the proposal allows for 2 legislative coordinators, one of which would be a member of the commission. I am, of course, not a member of the commission. I'm a past member of the commission. So we do need a member of the commission to serve as one of the 2 legislative coordinators. So if any of you are interested in doing that, it does require that you would be active in the Northern Virginia Aging Network. And I would certainly be willing and eager to work with and assist any commission member that would be interested in doing that. The other thing that I wanted to say is that one of the key functions, as you can see here, is bringing the NVAN platform before the commission for approval. That needs to happen today. And I just sent to Rachel, I hope you got it, a near final draft of the NVAN platform items. Of course, we don't have the backgrounds written yet because they will be written for the October 3rd legislative breakfast. And I hope you all have that on your calendar and are planning to come. But we do need to put before you and hopefully adopt the 7 NVAN platform items. And
thank you, Erica. And thank you, Kathy, for covering that. I hope you can all hear me. I think it's my firewall. Anyway, but thank you for presenting that and all the great things that Erica and our legislative group has accomplished working with NVAN. So we need a strong, interested person to be co-chair with Erica. And with respect to the legislative agenda, I think there's notice required, but Rachel, any comments on your side?
Yes, I just put in the chat the 2026 General Assembly platform. This was adopted by the Northern Virginia Aging Network, so regional network of the 5 agencies on aging, commissions on aging. But for us to, the county board is working much earlier to adopt the legislative platform at the county board level. So just in respect of time, we would like to try and adopt the 2026 platform for the Northern Virginia Aging Network to forward to the county board. The legislative items are: 1, to enable local jurisdictions to negotiate affordable unit set-asides in new assisted living facilities; reduce or prevent evictions by increasing the notice period and enacting other tenant safeguards; and then require a study of affordable housing options that address the prospective range of care provided in independent living, assisted living, and nursing homes. And then the budget items are: increase funding for critical area agency on aging services. The amount will be provided by the Virginia Association of Area Agencies on Aging after their July 29th meeting next week. protect Medicaid and oppose any cuts or barriers to access, fund a short-term statewide free certified nursing assistant recruitment and training workforce program for nursing homes, assisted living, and veteran care centers, and then appropriate almost $1.8 million to support the local or to support the statewide long-term care ombudsman programs. So I don't know if there's any discussion or concern from the commission about any of those items that were proposed. But I know a number of Arlington commissioners and friends are part of the Northern Virginia Aging Network.
Rachel, I see a couple of comments regarding accessing the form in chat. Is there another way to share that?
Let me try to save it as a PDF and share.
And are you saying that we can take action on this item today?
Well, I think is there any discussion or concerns about any of the legislative or any of the items that were presented?
Does anyone have questions or discussion? Please either raise your hand, or it's probably easier just to say something so that we can recognize you. It's hard to see everyone on 4 video pages here.
I was just wondering, are these all new legislative items, or some of them bringing forward from previous years? I'm just curious in terms of, success of some of these things over time. Do you know, Erica? It seems like assisted living. Okay.
Yes, assisted living, reducing or preventing evictions, increasing area agency on aging funding, and asking for funding for a CNA recruitment and training workforce. We're all on the platform for last year. The item about increasing funding for the long-term care ombudsman has been on the nVent platform for various amounts over the years, on and off. A new item is the study of the whole range of affordable housing options, including long-term care, and of course, protecting Medicaid and opposing any cuts or barriers to access.
All right. Do we have any other questions or comments? I saw a comment about unable to access, need a login.
I had a question.
Audrey, go ahead.
I'm working on the Affordable Housing Ordinance Working Group, and the goal is to try to increase the developer contribution to AHIF, because getting CAFs is less and less likely. But the AHIF contributions are about 1/3 the cost of a CAF, so developers are currently underpaying. That will need state approval, and we're hoping in January. I don't know that it's anything, it's not statewide, it's only Arlington, but just letting you know that this will be something that we're hoping will make it into January, but I think that the deadlines are very short. But I don't think, nVent is only statewide, right?
Yes, nVent is statewide. Of course, we hope that all of the items benefit Arlington as well, but it has a statewide perspective.
Okay, and this is Arlington only. Thanks.
Do we have any other questions or comments?
I just had a comment, Erica, question. When these legislative priorities are put forward, does nVent do anything about estimating appropriations that are needed to do these types of things? Or how does that work? Sorry, I'm still new to the process. Like the study, to do a really good study, they need significant amount of money, particularly for such a diverse state like Virginia, where we have, urban centers like Arlington County, and then many, many rural areas where the needs are very different.
Yeah. So as far as the study, I don't know whether you're asking whether the study itself would require funding, or whether the study would then assess the amount of funding for the recommendations.
No, it's really how how you get money attached to these priorities.
Yeah, so in some
How you
of
get it
these,
in the budget, basically.
yeah, in
Once they're
some of
approved.
these areas, we have put in funding amounts, for example, the area agencies on aging, and that will come from the statewide Association of Area Agencies on Aging. And
Okay.
for the ombudsman amount, that it has been calculated by DARS. And then for the CNA program, there was $3 million was requested last year, and that's still a possible budget amount. But NVAN has been working with the legislators to determine the budget amounts that would be requested, and of course, the legislators are in contact with the affected departments.
Great, thank you. That's very helpful.
All right, thank you. Do we have any other questions or comments? Apparently not. Rachel? Oh, go ahead. Is that Charlie?
I mean, I'd like to make a motion that we adopt these priorities and recommend them to the county board.
Any second?
I'll second.
Okay. All right, all in favor, say aye.
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 Any opposition? All right, the motion is adopted. Thank you. Great. And I assume during the lapse of the video, electronic meeting policy has been covered.
Yes, it was adopted unanimously.
Okay, great. Nominations, was that covered?
William, just as a follow-up to the policy, I guess a request would be if anyone is interested in serving as one of the coordinators with Erica to contact you or contact me about.
Yes, absolutely. Absolutely. Yep. Thank you for underlining that, Kathy. Yes, we need a strong, interested person. NVAN's great. You know, it has accomplished so much, and you get to influence statewide policy for older adults and get to work with the 5 entities, you know, Arlington, Alexandria, Prince William, Fairfax, and Loudoun. So it's great to work with your colleagues from all over. So yes, encourage everyone to step up. Thank you so much. Rachel, did we cover the nominations piece?
No, not yet.
Okay, did you want to cover that? Do you want me to cover that?
I could cover it. But we at this meeting is traditionally the meeting where we solicit nominations for the chair and the vice chair of the Commission on Aging. We do not meet in August, but in September is when we vote on those nominations. So if anyone is interested in serving as chair or vice chair, please let me, William, or Kathy know. We have been blessed that both William and Kathy are willing to serve for another year. But if anyone is interested, please do let us know, and we will have we'll actually have the vote at the September meeting.
Perfect. Thank you, Rachel. All right. Next, we see the committees and work group updates, and I see Charlie is on deck as next for the long-term care residences. Charlie, and probably a good time to bring up the draft comments as well.
Yeah, the committee has put forward a proposed comment on a pending regulation that's open for public comment right now. And this is kind of our priority right now. I did give William a written report of the update on the committee's work. The committee met in early July, and we also, some of us are involved with the Community Advisory Council for Cherrydale, which met on the 16th. And I did see one there in my dates, William, on the report I gave you. So I got to correct that with you. But the highest priority of our committee right now is to get approval of a comment that you have, if you've looked at the attachments to the agenda that Rachel sent out. It's entitled Comment of Arlington Commission on Aging on Proposed Regulation on Assisted Living Discharge and Appeals Process. A year or more ago, the legislature passed a statute directing directing that an appeals notice and appeals process be set up for assisted living, which is very significant because there is a appeals process for nursing home discharge, there's appeals process for people in rental housing, but there's no appeals process right now for assisted living. So the regulation was actually issued last year on what is called a fast track schedule, and the assisted living industry objected to the fast track schedule, so that was pulled and put on a regular schedule this year. The comment period ends on August 15th. We have reviewed this letter in the Long-Term Care Residences Committee and approved it. The Executive Committee looked at it and signed off on it last Monday, so it is before the full commission now. The appeals process would strengthen the notice that residents get for discharge. It would specifically identify as only 5 grounds for that one can be discharged on. It requires an opportunity to correct any problems that are identified causing the notice of discharge, and it provides for a fair hearing, which doesn't exist right now. I'd be happy to answer any questions about this, but we put this forward for your approval.
Okay, Charlie, thank you for outlining it. So my correct in understanding, the statute already exists, gives right to appeal, and the rule, the regulation is issued in response to the statute. And thank you, and Erica, for your hard work on this. You recommend adopting the draft regulation in its entirety. Is that right?
Yes.
Great. Does anyone else have any questions or comments before we take a vote? Okay. Okay, I don't hear anything. So all in favor, please say aye or just raise your hand. Thank you. Anyone against? Okay, don't see or hear anything. So the motion passes. And
so
Charlie,
just a point of information. Yeah. Rachel, can you tell us does the county board have to look at this? So what is the process at this point? Can we send this? Can we post this as a comment, or does the county board have to look at it?
Well, we'll still follow the internal process now that it's been adopted by the board, by the commission, to let the board know. But because they don't have any meetings prior, the commission, we can go ahead and post it. But I think Maimuna or I will follow up with you, Charlie, about how best to post it and kind of what contact information to list.
Okay. Thank you.
Yeah.
Yeah, thank you, Charlie and Erica, and thank you, Charlie and Maimuna, for all the hard work you and the committee are doing in long-term care. So really appreciate it. Transportation, Catalina, please.
Hi, everyone. Some quick updates for Arlington's Transportation Future, or the advisory group rather, for Arlington's Transportation Future. The project team recently released an equity analysis, which is pretty interesting, and it looks at areas within the county with higher vulnerabilities that don't have access to county services and facilities by walking, biking, and or taking public transit in less than 20 minutes. I'll put the link in the chat to the page where those resources exist online. But that's something interesting that I'm trying to dig into a little bit more, and would love to talk more maybe with the Equity and Engagement Committee about some of that. But our last advisory group meeting was last week on Wednesday. They started to preview the next stage of work coming this fall around scenario planning. So thinking about the future of transportation and some of the data that exists about how many people walk and bike and how that might shift over time, and set us up for our next meeting in September, which will go into more depth on what those scenarios are. They have different models and things that they can use to predict some of what that looks like, and then that will shape what policies are discussed and what ultimately, then we can bring to the community. And there'll be another round of intense community engagement happening in the fall with the community, just like there was, I think it was last year now. But so with that, the draft vision and goals that came about from all of the conversations at pop-ups and open houses and all that went before the county board this past weekend. And so the county board did adopt the resolution that endorses the vision and the goals for the refresh of the transportation element of the comprehensive plan. And so there were very minor updates that they suggested to some of that language, but it has mostly stayed the same. So again, you can find some of that language at the link that I shared, but the vision again says people of all ages, backgrounds, and abilities can move safely, comfortably, and seamlessly in Arlington. Everyone can rely on a variety of high quality, sustainable transportation options to get them where they want to go when they need to be there. And I think they edited it to say when they need to be there with added that word desirable choices beyond using a car. Arlington focuses on making travel an enjoyable experience for people, connecting them with nature, friends, family, and opportunities. So now that it has been endorsed by the county board, the next phase of engagement will again begin this fall to solicit more community input, and then that will guide additional discussions. And then I think summer 2026 is when the refreshed proposed plan will be brought before the board for adoption. So that a lot of work going on in that space, and you can keep tabs on that link that I sent in the chat for the advisory group to see. You're always welcome to join the upcoming meetings. The one in September will actually be an in-person meeting, so I can send a note closer to that date as well. Other things happening with the committee, we've still been engaging with the context that Helen provided us before she left with the independent living residences. So far this is in regards to our outreach and listening sessions with some older adults in the community around transportation challenges, suggestions. But we have one date that's locked in so far with Hunters Park. And so I can also have Rachel include this in the follow-up note, but happy to have anyone else on the Commission on Aging that's interested to join us. But some of us on the Transportation Committee will be at Hunters Park on August 5th. They have their National Night Out event that day, which is like a lunchtime event for the residents there instead of a night event. But essentially we'll have like a small window from like 2 to 2:30 to just introduce ourselves, ask some discussion questions, take notes, hand some resources out, like the transportation booklet that we have in English and Spanish. So very similar to what we did at the Social 60 cafes. But yeah, so that's happening. And Miriam at Hunters Park kindly offered to send a survey in advance too, if we want to gauge some questions about who uses STAR, Metro Access, or anything like that, and also offered to help with any translation that's needed. So we'll be working on that and continuing to chat with the other independent living residences on potential engagements. And then lastly, to just note that we are continuing to brainstorm around a potential pedestrian safety event, like a walk and roll, walk audit kind of event in the fall. So we've been having a lot of conversations with folks in different groups across the county. So I chatted with someone from the Independent Center of Northern Virginia, been talking a lot to Mary Dallow at Walk Arlington, connected with some folks at the Disability Advisory Commission and Pedestrian Advisory Committee, as well as some AARP folks. But just thinking through an event that can ideally be a way to raise awareness about transportation challenges, maybe build empathy around how we have to navigate the street if you have, different circumstances, get resident input, gather insights to help, provide an older adult or, disability lens to a lot of the data that already exists within the county around sidewalks. Because a lot of work's been done to date, but just adding in that layer of, older adults and the the communities that we serve. But more to come on that. I think that is all that I have for now. But happy to answer any questions, or if you're interested in anything I mentioned, happy to connect offline as well.
Do we have any questions or comments? Catalina, thank you so much for your energy, creativity, and your committee's energy and creativity and doing this outreach and getting out to the community. So thank you so much. Really appreciate it. So next is aging equity, and I echo, of course, what Rachel has stated earlier, and everyone has stated earlier. So thank you, Carlos, for your time, energy, commitment, creativity. You are a sterling example of everything that our members can and should do. So thank you so much, and we hope that you stay connected to us as an alum. So really appreciate it. Any words of wisdom you want to share? I saw that you put in something in the chat earlier.
Yes, my little emojis. I think emojis say a lot these days.
Yes.
So it's been an honor, and I'm very grateful for the opportunity. I sent an email over to Katie Crystal, who was at that point the person who I went to after having served on a couple of other commissions. And I said to her, I think I'm ready to serve on another commission. And I said, what do you recommend? And she said, this is the commission. I said, okay. So she wrote a letter, made the formal introductions, and the rest is history. And so I did go back and thank her also for the great opportunity that I've had working with all of you. So in terms of an update, we've had some progress, and which is really exciting in terms of being able to develop a short survey that will provide us input for our successes and opportunities for growth, for the training sessions that we have on scams. And I forwarded that over to Roland and to Michelle to review, and I think Rachel has it too. So I think we can implement that so that we capture some good data about what's working well, what can we learn from these training opportunities, because they've proven to be very, very popular, obviously, and making a difference, which is great. The other thing to say is that we're also making progress in relation to the development of an intergenerational programming for the county with LGBTQ older adults and young adults as well. And the Arlington Community Foundation had a gathering of their working group, which 3 of us are involved with, which is really great because that means that we can actually be persuasive as a group. And they are planning now an intergenerational storytelling gathering where we're going to hear, I believe, probably as far back from the 50s until now. So different individuals will tell their stories about what it meant to be involved in our community and what they were able to make a difference, or what issues were most pertinent. So we're still in the planning phase, but I love the idea. Not only are we going to have the storytellers or the speakers, but also we're going to have food that was popular during that era, which will be a lot of fun. I thought to myself, oh, Jell-O, would be fun. Frozen dinners, things that were that some of them have survived. Some are less desirable now with age, but I think it'll be a lot of fun. And so still in the planning phase, but it was a great first meeting, and I think the group is really looking forward to making that happen. I can tell you that we weren't successful in securing any dollars from the proposals that were submitted for creating that intergenerational online book club, but we're still trying, and I'm working on another possibility about, so I never give up. I'll keep trying. And even on the sidelines, behind the scenes, I'll be supporting Roland and the committee in finding new funding opportunities for any ideas that we have that we want to see funded. That's what I have. Roland, anything new from you?
Nothing else to add other than to let everyone know about the scam webinar, which has been set up for August the 18th. And it's a virtual, and it's entitled Exploding Trust, Exposing Scams That Impact Older Adults. We have a flyer pretty much on that. And I sent the flyer to you, Wham, but I think what I'm going to do is at the end, send that flyer pretty much to all of the members of the commission. And if you can send that flyer around to interested parties, friends, whatever, that would be great. There's one flyer in English and one flyer in Spanish. So hopefully we'll get a good attendance pretty much of that. I plan on having a couple of these to pass out at the fair, which I want to make I would like to make just a request to as many members of the commission as possible to sign up to handle a shift there at the county fair. I've been in the past. I have participated in the county fair for other commissions I've been a member of, and it's a good opportunity to talk to people about what the commission actually does and stuff. So it ends up being lots of fun. So hopefully we'll have some members here to pretty much sign up to be part of that that fair. And just to let people know that we have a meeting of the committee this Wednesday. And I think that's it. Carlos, have anything else?
No, Rachel, I have a quick question for you. So who have you been working with in the organizing efforts for the Arlington County Fair? Because they changed the way that things work around this year. So we have to get approval first if we want to be a vendor. So have you actually received an official confirmation that the county has been approved for, this year? And if so, who are you working with? Because we can send me that information, because I haven't heard anything. I've been trying several times to communicate with them, and I haven't heard it back from anything.
Yeah, so for the county, we have a special kind of section for the county that our communication team operates. And for Department of Human Services, Lizzie Alicorn has been our primary point of contact. So are you asking for like the county section or more of the like general vendors
The
area?
nonprofits, yeah.
Okay.
Yeah.
I can ask Lizzie who her point of contact has been and then reach out to you separately and try to connect you so you can get some response. Yeah.
That would be helpful. Thank you so much.
Yeah.
I can give a quick update on that. Carlos,
Oh,
if you go to the county fair site, there's a sign up page for if you want to, apply for a booth. And we did that months ago. I have to tell you, when I was at that site recently, they said all the booths are sold out. So it's being handled by the Department of Parks and Recreation now. I can give you a contact name there.
Yeah,
I'll
well,
send
we
it to you.
submitted our application way before the deadline. And
You should have heard from them a couple of months ago.
Yeah, I've been asking. No one's responding to my emails. I got one, and I asked, when do we pay, basically? And she said, oh, we'll let you know. But
yeah, they're sending out bills now. The first bill they sent out was not correct, so they're correcting them and sending out. I know, at least for us, we're getting a second bill, but I'll give you a contact name.
Oh, that would be great. Thank you, Wendy.
All right. Thank you, Carlos. And thank you, Roland, for taking on the chairmanship, and really appreciate the hard work that you both have done and presenting all the important topics, especially scams. I mean, that's a lot of good work. So really appreciate it. Next, we are going to Kate and Kasia for health and wellness.
Yeah. Kate, I can give an update and just jump in.
Thank you.
Yeah, so we've met on the 11th of July. During that time, we reviewed our progress on the strategic plan goals. We also followed up on some of the do-outs from the meeting we had with Macedonia Baptist Church. And so we're working with them to connect them directly with the resources in the community so that they can coordinate for the best time for them to provide the services to their church members. We've talked about the dental services, which we've come to the conclusion are very limited in overall, not just in Arlington, but Linda will be working on putting a flyer with dental services to kind of provide folks some guidelines. And Kate, anything I'm missing? We're scheduled to meet on September 11th in person at DHS.
Yes, and hopeful that that meeting includes perhaps a guest speaker from the Center for Optimal Aging. Kathy may have a contact there that could be informative, so we hope to move that forward. And then just the other pieces we're continuing to circle back on some information and speakers we had as a committee earlier in the year tied to the hospital and tied to discharge planning, and trying to circle back with them to see how we can help perhaps facilitate or, put in place some few strategies, tips, guidance to help people as they're leaving the hospital, particularly people that may be going to a higher level of care. So working with Fran and James on those issues, hopefully in the coming months or so.
Super. Do we have any questions for Kasha and Kate?
Yeah,
You guys have, go ahead.
Just very quickly, I just wanted to mention that, the presenter would be Erin Staker at our next meeting. She's from Marymount University. She presented at the Virginia Governors Conference on Aging on taking a bit of a deeper dive into the fact that Arlington for a number of years has been identified as one of the healthiest communities, or the healthiest community in the country. But is that all really true? And where are there sections of Arlington where we know that that is not true? And how can the Health and Wellness Committee or the Commission at large help to address some of the disparities in health that they've identified through their study? So that was the thought there. And perhaps, depending on the presentation, she might be a possible speaker for the full commission at some point.
All right. Thank you, Kathy. Thank you for shining a light on that. And thank you all on the committee for addressing the broad portfolio of issues that you have and moving out actively and getting those things accomplished. So thank you so much. Next, we have housing. Audrey.
Hello. You can all hear me, I assume. I'm going to provide a couple quick points, and Michael can add or interject as he wishes. I'm looking for my notes here. We had a very slow meeting last Tuesday. A lot of people are out on vacation. We talked about the housing ordinance that I am working on, and the current housing ordinance, which was passed in 2005, sorry, did not mention affordable assisted living. And although there have been developments of affordable assisted living, discussions anyway, I don't know that anything has actually been built. It doesn't mention, AHIF contributions were discussed. So what I want is to explicitly mention affordable assisted living so that nobody can come back later and say, but it's not mentioned. And I have the chair of the ordinance working group and the staff who think it's a fine idea. So we should have that locked away, which may or may not help us in the long run, but it doesn't hurt. The state would then sign off on it. So would be kind of sealed in stone, so to speak. I just want to make a sort of general comment, listening to everybody and all of that work they're doing and the progress they're making in various areas. Housing moves remarkably slowly. Outside of Culpeper, that has to empty their affordable assisted living in a year is a short time in housing world. So we don't have a lot of updates all the time, but Erica and I are going to work on programs to get out to the SPRC, the Housing Committee, and the County Board, the universal design document to see if they're well enough educated that they can talk to developers about it. We can't be at the meetings. We don't have ownership of that, but it would be nice if they were conversant in it. That's a goal. Another thing we're working on with Erica is getting out information about home safety and home safety resources and grants. And it would be great if somebody at the table at the county fair could have that information. I will be out of town, so I'm checking with the committee on that. And trying to remember if there's anything else. I don't think there was anything else that we're looking at in particular right now. So Michael, do you have anything to add?
No, just beyond the home safety is going to be our big push this fall, is doing more outreach and education around that topic with our county residents and staff.
Mm-hmm. Yeah, home safety and the universal design, which is aimed at developers or development. So they're kind of two tiers of the same thing.
Great.
Okay.
Yeah, thank you both so much for giving us the update. And with respect to, you know, the timelines, et cetera, I just want to share, I guess, a template from the national security arena, so that, you know, you have your ends, ways, and means is the general context. So the goals and the resources and the way you employ those resources, you know, that's those are things that you have to work with in achieving your goals. So yes, very important on what you can do and what can be achieved, and we have to analyze our resources and the context that we're working in. So thank you for doing what you can with the resources and the timelines that you have. So thank you, Audrey and Michael, so much. Appreciate it. Okay, next, I see that for the liaison updates, I see that Michael from Alexandria put some comments in there. Michael, did you want to give that update, or did you, if you're not here anymore? Go ahead.
No, I can do it just in case I got cut off, whatever. We lost you for a while, William, so I wasn't sure if I'd get
That's
lost
right.
as well. Let me just give you a quick update, since it seems like affordable housing is one of the popular topics today. And we have two things going on in Alexandria that might be informative. One is we have a senior rise building, high-rise building called Ladre with about 170 residents. It's all affordable housing. It's under, I think it's under 30% AMI. It's so dilapidated that HUD withdrew its support for maintaining it, so they're going to have to renovate it. So the city has to move about 160 residents, 130 who are 62 and over. So fortunately, there's a luxury independent living facility nearby that apparently is just really not doing very well financially, and the city has agreed with the Alexandria the Rehabilitation Housing Authority to purchase it. And so the city agreed to backstop the funding for it, and the Public Housing Authority went to the state Virginia Resources Authority. They normally issue bonds for like infrastructure types things like flood mitigation, but they now have authority under a General Assembly bill, I think in 2023, to use some of their funding for affordable assisted living or just affordable housing generally. And this is the first time that they've been able to actually do a loan for affordable housing for about $56 million. And so that has been approved by the state, and I think tomorrow they're gonna finalize the purchase of the building. So that's going to allow us to move maybe up to 110, 115 low-income residents into that facility by the end of the year. So it's really just fortunate that the timing worked out pretty well. And there's still a lot of financial risk because, you know, if they lose voucher funding, then that's gonna be really tricky. But they have a plan B if that happens. HUD cuts the voucher funding, which is going to be the cash flow that's going to pay for the debt service. It's a complicated transaction. But it's been well, I think, vetted, and it looks like it's going to go through tomorrow. The second thing that we have going on is I don't know if you're familiar with Goodwin Living. They have a facility in Alexandria, and right next across the street they have something called The View, and they're going to expand that from about, I don't know, maybe 100 units up to about 350 units. And we were able to get 7 units to be affordable. Under we have a special ordinance that if you ask for extra density or height, then you have to negotiate with the city to get some affordable units out of that development. So we were able to get 7 affordable units out of the 257 new units. What that means is that they have a buy-in of about half of what you would normally have to pay. The buy-in would be about 175,000 as opposed to 400,000. And then their monthly fee would only be $1,800. We did some studies indicating there is a large number of people in Alexandria who could benefit from this particular situation. So that's gonna take a while. It might take 2 or 3 years before it's actually developed, but it's actually in the pipeline. It's all been approved by the city, and it looks like it's gonna work. The third thing I just want to mention, we just had a community health assessment study or report released on July 8th. And what was surprising is that they found that mental health was the #1 concern of all age groups, including people 60 and over. And so when we do our community health improvement plan and the new age-friendly plan, mental health will probably be the top health issue that we're going to be pursuing in the next 3 years. Well, that's it. I put stuff in the chat if you want more information, and I sent William and Rachel some of the PowerPoints for some of these items if you want more information. But that's it.
Thank you, Michael. Audrey has a question for you.
Sure.
A couple of questions. What will happen to the residents of the Ladry that can't get into the new building? And what will happen to the Ladry?
Well, okay, 2 questions. Those who can't get in, it's only about maybe 30 to 40 may not be able to go to the Elate, the new facility. They will be able to relocate somewhere else, and they're working on that now. And I did take a note that I think we'll contact, was it Joanne McCarty, because we need to have a really tight relocation plan, do proper assessments, make sure that the people who can't go to the Elate can go somewhere else, at least temporarily, if not permanently. And once the Ladre is renovated, and it's going to take 2 to 3 years, then anybody who is currently relocated, they have a right to return. But 7 of the residents are over the age of 90, so we probably won't see everybody coming back to the Ladre, but that's going to be available in 2 to 3 years. So what's happening is that instead of just 170 affordable units, it'll be closer to 400 by the end of the day, probably in the next 3 or 4 years. So this is kind of a win-win situation. We see it as a win-win situation where we're just fortuitously expanding affordable assisted and independent living just because of the circumstances. Unfortunately, the market wasn't so good for luxurious assisted or independent living, so that's why this facility is available for sale. And then I think that it was, and the last part is, the Ladre is going to be renovated, and it'll have probably 270 units as opposed to 170.
Okay. Alex Now had an article last week about that, and they said that money wasn't there for the Ladry renovation.
I haven't seen that article, but
okay.
I have to. The last I had heard a few weeks ago, it was something that they were trying to get from HUD and other places. But I really don't have an update on that. But the last I had heard is that first of all, they wanted to get the funding for the purchase of the Elate, and then they were going to be focusing on the Ladre. But that's news to me that they don't have the money yet. But I know, talking to the CEO of the Public Housing Authority, he did have a plan B. So,
all right, I'll put the link. I'll put the link to the article in the chat in a second.
That's super. Thanks. I appreciate that.
Do we have any other questions or comments for Michael?
I think Roland.
Roland.
Michael, I noticed that on Richmond Highway, the landing was recently opened. It's been there for like several years. That's retirement living.
Yeah.
And also, I noticed that there's a sign for a new one called the Riviera. which is going to be assignment living. And also there is, now they've put up an Inova urgent care.
Yeah.
Is that all part of a plan for senior living in that area of Potomac Yard?
Well, I know that we used to have our meetings at the landing, and they're also they have a lot of empty units. But I think we have up to 7 or 9 affordable units there, or AG units there. I don't know. I don't think it's just geared towards assisted living or independent living. But I do know that the urgent care, it was just convenient because that area is kind of underserved. That's one of the areas I think our community health assessment plan is going to be looking at, because they don't really have access to health care in that area. But I don't think it's zoned, for independent living or anything like that.
And one last question: the huge apartments which are being built on Mount Vernon and South Lee, are there any set asides there for senior living?
Not specifically for senior living, but I think all the units are technically affordable at various AMI rates. I don't know if there's any below 30, but I think they're like under 60% of AMI, and then up to 80% AMI. That's going to be multi-use, and it's on, I guess, both sides of Glebe Road. And it's getting, it seems like it's almost done. It's not far from done, but they're really making a lot of progress. And again, that's just another example where our Office of Housing has been really very aggressive in trying to get as much contributions from developers for affordable housing generally. But our focus in our commission has been on independent living and on assisted living.
Great, thank you.
Yeah, and I did share some PowerPoints with William and Rachel. So if you wanted more information, maybe they can send those reports or those PowerPoints to you.
Great.
Yes. Great. Any other questions or comments for Michael? And I'll ask Rachel to send those out. I don't want to spam people, but Michael's brought it up a couple of times, and I'm sure there's good info in there. So, Michael, thank you for your comments. Always amazed at everything that you accomplish, not only for the Alexandria Commission, NVAN, everything else that you're doing. So thanks again.
Thank you. Back to you, William.
Okay, thank you. All right. I see age-friendly Arlington and 55 plus are listed on the liaison updates next. And I know we have the committees provided their updates on age-friendly. Kathy, in case you wanted to add anything, let me know. Otherwise, we'll move on to the 55 plus.
I can add something very quickly. Just wanted to, share that the age-friendly action plan task force met last Monday, and all of the committees were represented. And we tried to focus, first of all, on making sure everyone understands kind of the distinction between the task force itself and the council, the Commission on Aging, because I think there was some confusion about that. So Cynthia was great. She, Cynthia Davis, who's the co-chair with me, was on the call, and we had a discussion about that. And really, the task force focuses a lot on, kind of the process, what's required to have an age-friendly action plan, make sure that we comply with some of the requirements of AARP, et cetera. And, just kind of share updates generally as well, similar to what we do here. But I tried to focus it on, what were the 3 major accomplishments over the last year or so. What were some of the challenges the committees are faced with, and also, where is help needed, and also where might committees work together. So I think we had a really nice discussion about all of that. I will send out the notes. I apologize. I meant to do that last week, but I was out of town for a few days. So I'll share those notes with everyone. And Rachel, I wanted to thank you again for also clarifying that the task force does not need to abide by the FOIA requirements, but the committee meetings are open to the public. So just FYI, and we can meet virtually because we don't have to abide by those requirements. So anything else you want to add about Rachel about that?
No, it's just very similar to sort of the way NBN is, and yes, it's so we still want to invite the public to be part of the process, but it's a little bit, there's a distinction between it officially being a committee of the commission, and sort of a partner with the commission.
Yeah. And we meet just a couple times a year to touch base on things. And we do have an annual report that we have to submit to AARP, which I'll be working on that, taking into consideration all the updates that all the committees provide, which is a super big help. So thank you.
Super, thank you. Okay, 55 plus. I'm not sure if Jennifer is on.
I am. Hi, William.
Hey, Jennifer, how are you doing?
Good. Good morning, everybody. I just have a couple quick updates. Similar to what Rachel had shared with you all with staffing, we've had some staffing issues over the last almost year with one of our positions. It's been going on almost a year, but good news is I think we are almost have all our positions filled. We hired a new social 60 plus coordinator over at Langston Brown. That was actually due to a retirement. And so Daniel Burnell joined us about 6 weeks ago. He had a little overlap time with Cindy Leva, who had been the coordinator there for the last 7-8 years. So they were able to do some training. So Daniel's there and fitting in really well. And so things are going, actually, they've had some growth. They'd said over the last month, about 5 more people joined the Langston program. So that's always good news. And with that, we had an opening at Arlington Mill and for our director position, and Mona Farah, who had been this program coordinator at Walter Reed, stepped in as acting, and actually Mona ended up being selected as the new Arlington Mill Center director. So she's been there about a month now acting, and so with that left a vacancy, but we were able actually to pull from our recruitments for when we went out for the Langston position, and all goes well, we should have that position, the Walter Reed program coordinator, filled by the beginning of August. So we're just the final HR paperwork's going through with that, and the same with our Aurora Hills position that had been open since last August. We'd gone out, didn't get a lot of candidates, and then we got caught in kind of not official freeze, but frozen due to some budget stuff. But we were finally able to go back out, and we had a really great pool this time, and we're excited that position will hopefully be filled by the end of August, end of July, early August too. We're just waiting on, again, final HR paperwork. So once that's done, we'll be able to share the names of the new staff. And the other thing, we held our 55 plus leadership luncheon on June 26th at the Jefferson, hosted us again this year. And we had over 80 people in attendance, and along with 4 county board members, and William was able to join us also. And so it was a nice day luncheon. This is when we also do the installation of our new officers. So our department director did the ceremony for the new officers. The word was not coming to me. Installation. And so Don Hesse will be our new chair for the Senior Adult Council. And so David Littman will be our past chair, but I believe David may start coming to these meetings as our liaison like Andrea did. So hopefully he can start doing that in September. So y'all can hear from the Senior Adult Council instead of me on these reports. So, but I think that's everything we have really kind of in the works right now.
Thank you, Jennifer. Yes, and I know Arlington's always at the top regarding healthcare, but Park and Recreation has also been named as #1 in the country and is always in the top 5. So thanks to the Park and Recreation Department. And 55 plus put on a lot of programs that are relevant to us, including a SCAN program, transportation options for older adults, estate planning, and so thanks for everything that you and the department are doing.
Thank you.
All right. Do we have any other liaisons wanting to provide an update? Okay. All right. Then we shift next into any old business, new business, and announcements. Do we have any old business? Not seeing any. How about any new business? Oh, Rachel, you made a move. Is that old business or new business?
Oh,
okay.
No, sorry.
All right. Okay. All right. Not hearing any new business either. Do we have any announcements? We've heard about the county fair. Please participate. They used to give free T-shirts to everyone who joins the DHS or Commission on Aging table. So maybe we'll have those this year as well. Any other announcements? If not, wish you a great summer. Enjoy the next month off, and see you in September. Thanks a lot, everyone. Meeting is adjourned. Take care.
Great summer.
Thank you, William. Bye, everyone.